Across the country, at least 240 people have tested positive for COVID-19. Ontario has 26 new cases as of today. There are now more than 100 confirmed cases in that province alone. BC has the second highest number of cases with 73. 3 new provinces are reporting cases today. Prince Edward Island confirmed its first case. Newfoundland and Labrador has 1 case, and Saskatchewan reported its first 2 presumptive cases. Elsewhere, New Brunswick is dealing with 2 cases. There are 4 in Manitoba, 39 in Alberta, and the number of cases in Quebec has risen to 24. Quebec's provincial government has adopted a health emergency decree that will be in place for 10 days. Abigail Bimman has the details in our top story tonight.
I like that one right there.
Visiting from Boston, the Fernando family explores this Toronto aquarium, one of the few major attractions open.
It was getting scary coming up to the date, but we figured we're going to do something this weekend, it being my birthday, whether it's Boston, whether it's somewhere else. What's the difference?
Right now we're staying open, and as I said, we monitor it hourly. We know exactly how many people are entering the building, exiting the building, so we do control the amount of people in the building, so we keep it lower than what it normally is.
The new coronavirus making for a tough start to March break, but lots of people aren't staying home.
We're keeping our distance, we're washing hands, we have hand sanitizer. I don't know how many containers of it we've got with us.
3.
Yeah.
We have to be alert and responsible.
Friday, Ottawa asked Canadians to avoid travel outside the country. A tweet from the Foreign Affairs Minister Saturday took things a step further, recommending those already abroad come back via commercial means while they are still available.
All travelers coming to New Brunswick must continue
At news conferences Saturday, many provinces echoed the federal message and in some cases took it further.
If you travel abroad, you could be subject to the measures of other countries. Your 1-week trip may become much longer. You may also have reduced access to quality health care.
I would like today to ask all Quebecers over 70 years old, so all elders, to stay at home. And I would like to ask all Quebecers that can help them getting, for example, some food, to do so.
Prince Edward Island declared its first case of the new coronavirus, while the Premier announced he's self-isolating with his family after spending less than 24 hours in the United States. Nationwide, people have questions and healthcare phone lines are overwhelmed. In Manitoba, they're hoping some helping hands will cut down on wait times.
We've had lots of interest from physicians, nurses, students, retired people, and we are very grateful for that, and we will definitely make use of that.
Ontario is limiting the volume of test swabs supplied, citing an increased demand. And in BC,
people with mild symptoms and returning travelers who are isolating at home do not need to be tested unless you get sick enough to require health care.
Both provinces stressing it's all about making sure those who really need the test get it. Abigail Bimman, Global News, Ottawa.
Right across Canada, homeless shelters are on alert for COVID-19. It's a segment of the population already at high risk with any serious virus. But as we are now learning, the new coronavirus can be devastating. As Mike Armstrong explains, shelters and missions are already cutting services, planning for worst-case scenarios.
It is a population without many of the things most take for granted. Not just a bed, but also things like sinks and washrooms, places to keep clean. Put hundreds of homeless people together in a shelter, eating and sleeping close together, and you have the perfect recipe for a virus like COVID-19 to spread.
We are at a heightened risk. We can't change that. That's the way a shelter is.
Shelters are ramping up cleaning procedures. They always worry about germs, even at the best of times, but this is different. The homeless population is at a higher risk from COVID-19 because many already have other health problems.
A lot of them have respiratory tract illnesses, chronic heart disease, hepatitis C.
Much of the last week has been spent on education and vigilance, making sure people already vulnerable were careful. But the worry now is turning to what if? What would it mean if COVID-19 got into the homeless population? Most big cities' shelters already hover around 100% capacity. What if people have to be quarantined?
If at any point anyone is asked to self-isolate, how are you going to self-isolate if you don't have a home to go to?
Some of the harder hit areas in the U.S. have already taken special measures. A county in Washington state bought an Econo Lodge motel and has turned it into a quarantine facility for the homeless. While the city of San Francisco has leased 30 recreational vehicles and parked them.
Well, I think that the mayor and the city has made it very clear that our number one priority is vulnerable populations.
In Montreal, the 4 major shelters are always in close contact. They've dealt with threats together before. Back in 2017, it was an outbreak of flesh-eating disease. They are now cutting some services. A warming center is closed as of this weekend. Some are suspending volunteer activities. They're also only serving meals to people staying at the shelters. People from off the street can only get meals to go, and many understand why.
Virtually everybody that we come into contact with has heard about COVID-19 and is concerned.
Now, there are worst-case scenarios being studied. Shelters and missions don't have big reserves of cash or extra facilities they can open up. Well, one Montreal shelter says it's considering making an appeal Monday, requesting the military be deployed to help with the homeless population. Mike Armstrong, Global News, Montreal.